any chronic disease, and people haven't really gotten into the idea of recognizing obesity for being the chronic disease that it is. So if we're using a drug to treat obesity, like we were treating diabetes or high blood pressure or anything else, we don't go on it with the idea that we'll stop it. So you don't go on high blood pressure medicine and say, hey doc, well, when do I get to go off of that? If we're using it to treat high blood pressure, we may be using 1 or 2 or 3 or even 4 agents, some people 5 agents. The goal is to get incremental benefit with the added use of these medications, but you don't magically think it'll stop one day. Just like if we start someone on, medications for high cholesterol or medications for diabetes, we don't say, oh, let's put you on. Okay, let's stop. Let's see what your blood sugar does. This is exactly the thing. And I think we have to get out of the idea of not thinking about obesity in that same way that we think of other chronic diseases. We don't, just say, oh, let's stop it. Let's see what happens. We know what's going to happen. It's pretty obvious. So the study, the data from Wilding and colleagues, et cetera, when you stop these medications, you do begin to rapidly regain your weight because we're no longer impacting the areas of the brain or the GI tract that we were impacting, right? As soon as you pull that away, the 4 things I just said are no longer going on, right? So what do we expect? We expect to have regain.